everyone. Welcome to episode 2 of series 1, discussing on childhood and teenager disorders. Today, the topic for discussion is ADHD, which is the abbreviated form of Attention Deficit Hyperactivity Disorder. So, what exactly is this? This is a very common disorder amongst children. And being a principal for a Cambridge International School, I've come across many students, especially the Cambridge primary level students 5 years and above, who are affected by the disorder. So, the common question of the parents, so how do I deal with the problem? For the teachers, even how to manage or handle such child in the classroom. So, here are tips to such queries. First, let me discuss a little bit, throw some light on what are the symptoms, how to identify that a child is affected by ADHD syndrome. So, what exactly is this? Definitely, this is a behavior condition, a mental disorder, wherein there are two categories. One is a attention deficit part of it, the other is a hyperactivity, the hyperactive part of it. So, coming to the first part, the first category of the ADHD disorder, which includes the attention deficit part, definitely there is lack of focus. A child cannot concentrate on a particular task for long, cannot prioritize on work, suffer from poor time management skill, cannot retain attention for a long time. So these are some of the symptoms of the attention deficit part. Now coming to the second part of it, which is the hyperactivity part of it. So some of the symptoms over here, the child cannot sit in one place for long, keeps on fidgeting, focuses on the phone for a long time, and also the particular child cannot sit in a classroom structured environment, keeps on moving or getting distracted. So what's the solution to it? The question is that can we treat such disorder, or is it something which cannot be treated? Definitely there is a ray of hope. As a psychologist, I can suggest certain tips. Tip number 1, while dealing with ADHD disorder, the first thing to focus is that to create an environment of empathy. Over here, we focus on three things, three C's. What are the three C? Consistency, collaboration, and concentration with celebration. So, what is that? What are the things? Coming to one point at a time. First, what should be the role of parents? What should be the role of the teacher in this regard? Before we dive into the topic, first, let's speak on how to identify such child. Because there's a thin line difference, between between a child who is lazy and between a child who is affected by ADHD disorder. So, how to identify? Because we cannot just label a child just like that, telling a child is affected by ADHD just by looking at the superficial symptoms. It has to be referred to a clinical psychologist, and through interview and physical examination, it can be determined whether the child is affected by ADHD. Now, what are the ways of assessing? The ways of assessing, first, the parents are interviewed to understand, what the child goes through, what are the concerns for the child, so that, the session, the examination, and the interview of the child can be tailor-made according to the needs of that particular child. Step number 2, the child is undergoing a certain test, a physical test. Along with that, an interview wherein a couple of questions are asked to understand the basic need of the child. After that, the psychiatrist with the psychologist comes up with a comprehensive report identifying the symptoms, the level, the stage of that particular disorder, and the mechanisms to cope with the problem. Now, coming back to once it's identified, what are the steps to be followed? As a parent, it's very, very important to set an environment, a very, very structured environment, because over here the child lacks focus. So the best learning method for the child is a space learning method. Now the question will come, then what exactly is a space learning method? Space learning method wherein the child has to focus, it's called a 7 and 3 minutes rule. 7 minutes of study with a 3 minute of break to allow the child to refocus. Now, the question is that such children, can they go to a normal school or they should be recommended for a special needs school? The question to it is that depending on the intensity of the problem, if the child is having mild ADHD, can definitely go to a regular school. But the parent has to inform, the school authority at the time of admission so that proper care is taken. The next question boils down to, then what is the role of the class teacher or the teacher associated with teaching that particular child? Definitely, the role of the teacher plays a very, very pivotal role. The teacher needs to set up an environment of empathy and praise for the child. Even the little effort put by the child needs to be appreciated so that the security of the child gets built up. The self esteem of the child gets built up, which is very, very low for a ADHD child. Point number two, the teacher also has to follow the practice of space learning, meaning teaching but also allowing the child a break in between, allowing the child to refocus. That's very important. Point number three, proper classroom techniques management. Allowing the child to sit in front of the teacher so that the teacher can have an eye on the child. Not to ask the question to a child which demands an impromptu answer, because such children are not capable of giving an impromptu answer. So what happens? The child feels ashamed, which can actually aggravate the problem. So teacher should restrict from asking a question to the child which demands an impromptu answer. So these are some of the techniques that even the teacher has to be very mindful. Other ways to tackle such situations should be relaxation techniques, stress exercises, so that, with this mindfulness, what can happen, it can help the child to focus better and in a way will help the child also to keep away from wandering and, like getting distracted so easily. Now coming back to some other questions, common questions like, can my child actually do, prosper in career? And the answer to it is that there were many such people in the past who are leaders today suffered from ADHD. Two such prominent names are Bill Gates. Bill Gates himself suffered from ADHD disorder, and you know how celebrated an entrepreneur Bill Gates is. Same goes for Michael Phelps. All of us know he is a renowned swimmer. He also suffered from such disorder. Now, how was it possible reaching that heights despite suffering from the disorder? Some of the good traits of such disorder are hyperfocus, creativity, spontaneity, thinking out of the box. So people with such disorder are actually good in just thinking creatively, uniquely, and also to refocus. So all these are actually traits needed to be a good entrepreneur or to flourish in other fields as well. But the question is that everything boils down to how the symptom and how the disorder was dealt with. So it is also important to identify such disorder, take the help of a professional counselor, psychologist, psychiatrist, so that the treatment is timely and the coping mechanisms mostly can be dealt better. Some of the treatment of ADHD includes behavioral therapy, cognitive therapy, to help the child, address the sensory issues, to develop the social skills of the child, and also occupational therapy, which takes care of the social skill part. Skill building therapy, and also certain part of stimulants and non-stimulants. So addressing that will help to reduce the symptoms. If all the treatments are done timely and in a proper manner, Teachers, parents, with the help of the professional counselor, can actually help to cope with the disorder much better. So it is very important to identify it. And generally, statistics have shown that the symptom actually comes to the surface from the age of 5 or beyond. Okay. And also, statistics and research has shown in the past ADHD is more popular in boys compared to girls. The next question which comes is that is it a genetic disorder? Yes, genetics do play an important role. Research has proved that, definitely it plays a very important role, but it is not the only factor responsible. The other things involved with such disorder includes anxiety disorder, substance abuse, bipolar disorder, mood swings, which also has to be dealt with properly. Having said everything, this disorder can definitely be cured, but environment of empathy and patience is the key to it. Teachers, parents, with the professional counselor plays a very important role in helping the child to overcome this disorder. So this was all about the session wherein I spoke about the different symptoms, the ways what should be the role of the teacher, the parent, and also what are the treatment techniques. I think this session will definitely benefit you all, and I really hope you're going to join me for the next session where I'm going to talk of some other disorders related to childhood and teenage period. Thank you very much. Signing off. And before I sign off, request you all to subscribe my channel, Dr. Sanjuti's vlog, and also share and like. Thank you so very much. Meet you again in my next session. Thank you.